So I gave the hardest job to our last speaker, Tom Bunnell, who's the director of the Center for Health Law and Ethics at the Pierce Law Center. Because I asked Tom, who follows, and he's like a bird dog, he follows what's going on in Concord, he follows what's going on in Washington in terms of health reform, to talk to us about what's out there and what's being proposed. And Tom's biggest challenge was to give us all of the changes that he heard about today, because as we're making sausage in Concord and Washington, Tom's trying to make sense of it all, so he's going to digest it and let you all know what's in the crystal ball.
Thanks, Wendy. I want to refer to my notes every now and then, and I am nearsighted. If I stand up, I'm not going to be able to see them, so I hope that's okay. I am, as Wendy said, I'm director of Health Law and Ethics at the Pierce Law Center, and actually ethics has nothing to do with what we do. I'll confess that to you. When our institute was founded about 15 years ago, it was focused on medical ethics, which long since has stopped being a focus. And we actually thought about changing our name, but we figured out that the only thing worse than having ethics in your name is taking ethics out of your name. Having to explain it to we're grant funded to monitor developments and options and opportunities on a health policy level at the state and federal level. And we also do some grant-funded work with public policy consulting work with healthcare, public interest healthcare coalition. I am PowerPointless today, and I just want to say really honored and humbled to be here with this wonderful and thoughtful group of folks I'm enjoyed listening to, and hope you have too. We really are at a fascinating and unique and exciting moment in history right now. I don't want to lose that. Are you familiar with the Chinese symbol for change? This wonderful kind of two interlocking characters, simultaneously present. Hidden danger, hidden opportunity. And right now, at the national health reform level and in terms of dialogue, it really can be characterized more as hidden danger, latent opportunity. So I'm going to leave about that. But I was trying to figure out how today, talking about the public policy state and the political plan versus, what specifically health reform might look like. And I'm going to try to do a little bit of both. Partly because the details are continuing to come out of Congress about what health reform might look like. For example, the Senate Health, Education, Labor, and Pensions Committee came out last week with a 615-page preliminary draft proposal that has something like 40 different options in it that are not yet determined that could go a variety of different ways. So repeated public polling, national public polling over the course of the last year about what are people's economic concerns. And healthcare costs are the #1 concern by a long shot. Not losing your job. Healthcare costs. Astounding. So you all get it. People get it. But guess what? Policymakers are now getting it. Economists are getting it. The president sure gets it. Congressional leaders now get it. So very promising. But going back to the approach, stabilizing the economy requires stabilizing healthcare costs. Stabilizing healthcare costs, though, is actually a two-step that turns at previous, probably not your conventional wisdom, but previous conventional wisdom on its head. The two-step is stabilizing healthcare costs requires covering everyone. Health insurance coverage for everyone. Let's say that again. Stabilizing healthcare costs requires covering everyone. It also requires, the second piece is it requires system reforms, healthcare system reforms, not just reforms relative to insurers, but reforms relative to healthcare providers that bend the cost curve down. So remarkably, there is broad and bipartisan acceptance that the uninsured and underinsured, that we have to be addressed, that we and not just because it's a moral plight, which of course it is, and not just because it's a commentary on who we are as a nation, because it's that too, but because it is a necessary precondition to making our system efficient and rational and cost-effective. I'm just going to take a minute and explain that. Unless we cover everyone, we cannot eliminate the cost shifting that folks on this panel have been talking about. Can't do it. Folks are using emergency rooms instead of going to the doc. Folks who have preventable illnesses that could have been prevented, folks who have chronic conditions that aren't being treated that turn into much more expensive conditions, those who are insured are all paying for those now. So unless you cover everyone, you can't do chronic care management or prevention in a way that makes sense. And forgive me, but there aren't even close to being enough wonderful community health centers like Helen has. But I will say this, as part of, I will mention a couple of specific things as to the emerging national health reform proposals. They all propose to model after and strengthen and increase the number of community health centers like Helen's. Anyway, I think a lot of us, and hopefully a lot of you have seen the breakdown in healthcare costs. The data shows that about 5% of people in America who have all of them have chronic diseases, incur about 50% of all healthcare costs. Again, astounding. We can't get out that without chronic care management prevention. And we can't do that with people bouncing it out of the system and not being covered. So there is some widespread acknowledgement around this table and elsewhere that we need to cover everybody. And I'll say one more thing, and I'll bridge back to my friend from the insurance community over here. If you believe, as the president and congressional leaders who are bipartisan and lots of other folks do, that insurers should not be allowed to discriminate on the basis of health status or age. So guaranteed issue coverage, no discrimination, no special sickness-oriented underwriting. Insurers are saying, how can you require us to insure people who wait until they're sick to get health care or to get health coverage? And the truth is, you can't. So we've got to cover everybody, and that is a major, it's an incredible development, but it also is a big and relatively undisputed part of the national health reform dialogue, again, on a bipartisan basis. Let me also